Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of our flagship stations 89.3 Lakes FM and Civic Center TV. Civic Center TV on Comcast Channel 15 and AT&T Channel 99 in West Bloomfield, Kegel Harbor, Sylvan Lake, and Orchard Lake. We're also joined on the same channels, Comcast 15, AT&T 99 in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin on Birmingham Area Municipal Access, the service of the Birmingham Area Cable Board. In addition, today on the radio, 88.1 WBFH, the BIF, a service of the Bloomfield Hills School District, and online, civiccentertv.com. Click on our Watch Live link on our homepage, or watch on the small player there as well. And today on Facebook via Facebook Live, we are joined by our friends over at Oakland University, and thank their entire team for joining us on today's edition of the Oakland County Megacast. And as always, joining me in the studio for today's program is Ronnie Dahl.
Happy opening day.
Yes, opening day for the Detroit Tigers today. A chilly one, too. It's not going to be the most enjoyable playing experience out there for our Tigers today.
One of the best things to help the mayor try to keep the crowds away. Mother Nature on this lovely 1st of April, playing a big old joke on us, waking up to snow.
Yes, waking us up to snow. And you know, we also just had one of our cameras, camera 7 over here on your shop, play a little bit of an April Fool's joke on us. I got it onto your framing, and then it immediately started panning left. A ghost took it over. So a couple of April Fool's jokes coming our way at the beginning of this day. One from Mother Nature and one from grandmother cameras.
I will say, my husband kind of got me good this morning. He's like, he was like, hey, baby, there's an Amazon package on the front porch. Go get it. And I was like, I haven't ordered anything recently. And I know he never orders anything from Amazon. And, of course, then I opened the door thinking, did I do late night shopping that I forgot about? Not to say that doesn't happen every once in a while.
We all do it.
And then, of course, I opened the door and there's nothing there. And he's like, April Fools.
You know, I feel like April Fool's has become less of a thing in recent years. I don't think people are really going as crazy with it anymore as they have before. Maybe it's just like the last year hasn't been anything because, you know, we've all been waking up every day hoping this was all one big joke for over 365 days. But I feel like it's not as big of a holiday anymore.
Well, that could be we're getting older as well,
yes,
Tyler.
Yes, that certainly helps.
Well, Volkswagen getting backlash on what they were trying to do with their April Fool's joke, saying they were going to rename the Volkswagen, and come to find out it really is just a joke. And so they're getting a little bit of backlash because a lot of news outlets picked it up like a real story.
Yeah, and a lot of these corporations that have tried to do these cutesy jokes on holidays lately, they have swung to go on topic with opening day on theme. They have swung and miss on them, and sometimes gloriously. I mean, we look back at International Women's Day when Burger King had their attempt at humor, which was the absolute worst idea. The fact that anybody on their team thought that
What'd they do? I don't remember that.
They made an ad. It was in the United Kingdom specifically. They had an ad that said, "Women belong in the kitchen. Happy International Women's Day," which anybody with half a brain could immediately say, well, A, that's not funny, and B, we really shouldn't publish that. That can only go wrong. Especially on this day.
They obviously didn't have women a part of that marketing team.
Yeah, clearly they didn't, which for a marketing ad you're putting out there for International Women's Day, kind of also a problem too.
Well, hey, you're still talking about it, though.
Yeah, not for the good reasons.
I know. But they do, sometimes they say.
Yeah, any press is good press.
Exactly. So, hey, what are your predictions for the Tigers this year?
I think they're going to be improved from last year. It's not saying a whole lot. I don't think it's going to be a massive improvement. I don't think they're contending for the American League Central or a playoff spot. But they got a lot of young players coming up, and they brought in some quality veterans as well. I think the biggest goal for the Tigers this year is developing those top-level prospects, the guys like Casey Mize, and seeing them take a step forward would be huge for the Tigers, because if these young players, these top-level prospects, are able to show that they have significantly developed in the past offseason, that that changes the direction of the rebuild to where maybe the Ilitch family goes back to the perspective of the late Mike Ilitch and says it's time for us to start spending some money and bringing in some high caliber players and kicking this rebuild into high gear.
So I'm wondering too, so of course this year they are going to be allowed to have some fans. Around 8,000 fans are going to be able to attend the game. They'll be sitting in pods and be socially distanced. But I also wonder, is this kind of good for the Tigers? Because the last time prior to the pandemic, I remember seeing the cameras do a crowd shot during some of the games. Yeah. No one was there. No one was there because they were terrible. And some of these tickets are so expensive. Like, I couldn't imagine being a family of 4 or 5 buying the tickets, the parking, the food, the hot dogs, the drinks. I mean, you're really looking at a few $100s to go watch a team that stinks.
Yeah, it's the experience is not as fun for people and not as incentivized for people to take in when their team is so bad. And that's the big struggle for these Detroit sports teams right now, because all 4 of them are in a rebuilding phase, and some of them have been there for a long time, much like the Lions and the Detroit Pistons in particular, who, in past years we've seen with the Detroit Tigers at their best, every single night, Comerica Park is an absolute blast. It is roaring, no pun intended, every single night. And it was the same way with the Detroit Pistons when in the going to work era with the 04 team, and around that time, every single night the Palace was an absolute blast, and it was loud as it could possibly be. And now what we're seeing is these empty seats. And what we see in other cities and with other teams that are in these situations is they run a lot more promotions, they run a lot more deals, and they lower their ticket prices. And that might be something, as crowds start to come back to stadiums, that our Detroit teams need to consider, because recently, with the performance of these teams, Detroit fans would rather watch at home than pay a premium to see a low-quality team in person.
So a lot of people are really wondering right now. We had mentioned it yesterday as to why the governor and the Department of Health and Human Services have not started cracking down and putting some restrictions back in place, because the numbers are surging right now. So I do think that's going to help keep the crowds away from downtown Detroit today. COVID-19 cases, hospitalizations, and case positivity rates are spiking across Michigan, but restaurants, bars, and schools remain open with some health restrictions. So in the early days of the pandemic, the state put into place that My Safe Start plan. Remember that?
Yes.
To create the COVID-19 safety metrics by region, which would help contribute to reopening plans for different sectors of the state's economy as well as the schools. But after a year, that seems to have fallen by the wayside. So across the state, COVID-19 spread is worsening. Of the 8 regions in the plan, 5 of these regions are in the E risk level, which is the highest risk. So the governor's office and the Department of Health and Human Services, they were asked, is the state considering reinstating stricter restrictions for bars and restaurants like Michigan saw during the past surges, or if the state is considering closing schools or shutting down some of the youth sports. So a Department of Health and Human Services spokesperson said the state is going to continue to monitor the data to make decisions, including 3 key metrics: case rates, percent of positivity, and hospitalizations. So they're looking at that, they're setting a goal, and the goal is to re-engage while reducing public health risk, which is why the health department is moving slowly to maintain progress and momentum with thoughtful public health measures. So the governor's office and basically the health department really not getting into specifics, and the governor hasn't done one of her press updates recently. I think, what was the last one, like 2 weeks ago?
Yeah, it was about 2 weeks ago, and it seems to me like our leaders in the governor's office and in the Health and Human Services Department are kind of shying away from really addressing this publicly, because Michigan went from being one of the more effective states in preventing COVID-19 cases across the board over the several spikes we've had across the United States with COVID-19 over this past year. And in this current one, we are at among the worst in the entire country, and there seems to be a reluctance to roll back some of these lifted restrictions, as has not been at all a struggle for the governor and for the Health and Human Services Department before, when this current spike is trending more severely than we've seen the beginning of previous spikes. And to have no information on that, whether it be brief clarifications from a press conference or a statement at the very least from the Health and Human Services Department, it seems like they're saying with this statement, we don't want to roll things back again and tick off the business community and tick off other Michiganders that don't agree with that. But at the same time, we want to prevent cases, but those don't always match up.
Yeah, I know the governor was on CNN this past weekend. She does a lot of those national news talk shows. And she was, one of the things she was saying is that, hey, we're trying to get more vaccines into the arms of people, and so she has tried to increase the number of people that are going to be available for starting to get these shots. We know that the day that it effectively opens up for the entire community, into which 16 and above, is April 5th. But they are saying right now, look, if you have some left over, vaccinate anyone and everyone.
Yeah, I mean, we are, as Dr. Faust had said, Dr. Russell Faust from the Oakland County Health Division previously, in a race against the clock against these other variants popping up across the board. That wasn't as much specific to this. But it seems, too, like the governor's approach to this is we're in a race against the clock to get people vaccinated and try to reduce these spikes without putting more restrictions in place, which is definitely a change, of course, from her previous actions throughout this pandemic. And it's an effective strategy because shots in arms help to lower the risk of hospitalizations. It doesn't prevent it all, but it helps to lower the risk. The problem is the pace at which this spike is increasing over time is very, very rapid, and we may not have the time to make those adjustments through vaccinations. There may need to be restrictions in place, even temporarily, just to halt the progress of the spike.
Well, we know some people are very hesitant to get the vaccine, and you know me, I'm kind of waiting for the Johnson & Johnson for no other reason than I don't want to get 2 shots.
Right, that's a lot of people's
needles, I get queasy at the thought of needles. So, but Johnson & Johnson's vaccine is delayed here in the United States because of a factory mix-up. Oops. Workers at a plant in Baltimore manufacturing 2 coronavirus vaccines accidentally combined the ingredients several weeks ago, contaminating up to 15 million doses of Johnson & Johnson's vaccine, forcing regulators to delay authorization of the plant's production lines. So the plant is actually run by Emergent Biosolutions, a manufacturing partner to both Johnson & Johnson and AstraZeneca, the British-Swedish company whose vaccine has yet to be authorized for use here in the United States. So federal officials attribute the mistake human error. Oops, we made a mistake. So the mix-up has delayed future shipments of Johnson & Johnson's doses in the United States while the Food and Drug Administration investigates what really happened. So the error does not affect any Johnson & Johnson doses that are currently being delivered and used nationwide, including the shipments that states are counting on next week, because all of those doses were actually produced in the Netherlands.
Yeah, this is something that's going to be very concerning for a lot of people that are looking to get the Johnson & Johnson vaccine, or just for general confidence in these companies that are producing the vaccine, having a factory mix-up, especially when 15 million doses, that's not a small number by any measure. That is a staggering number of doses that were affected by this contamination. We haven't heard of a lot of these factory mix-ups that have happened, if they have, over the course of this pandemic, probably because if they have happened, they haven't been nearly this severe. But the confidence in these companies, everyone's going to have eyes on them all across the world, because their ability to manufacture these effective vaccines effectively is critical to the future of the world population as we try to come out of this pandemic.
I found this interesting. Beaumont Health Systems is requiring visitors vaccinated against COVID-19 to show proof before they can see loved ones being treated at the hospitals. So the move is part of the healthcare company's effort to protect its patients as the number of COVID-19 cases in Michigan surge. It also comes about a week after Beaumont reinstated visitor restrictions and limited who can see patients at its hospital. So under the policy, which started this morning, patient visitors must have finished their vaccination schedule, be 14 days past their final dose, and show proof of the vaccinations. So they can accept two forms of the proof. Like you can either bring in your completed vaccination card with a photo ID, or take a picture of your photo or of your vaccination card rather than carrying it with you. So as of Wednesday, the healthcare system said its number of COVID-19 positive or suspected positive inpatients had skyrocketed from 128 at the end of February to more than 500 patients as of Tuesday. Beaumont is treating more than double the number of COVID-19 patients than any other hospital system here in the state of Michigan.
Yeah, and Beaumont previously, when they reinstated their visitor restrictions, they were kind of ahead of the game necessarily from other health systems in the local area in doing that and taking that precaution. And now with this metric in particular, the increase from 128 inpatients being treated for COVID-19 to 500 in just a matter of a few weeks. And then on top of that, the fact that this health system is treating more than double any patients of other health systems in the state, it's becoming a growing concern. The biggest concern, the reason that we've had all these regulations put in place and restrictions put in place throughout the pandemic is to prevent hospital systems from being overwhelmed. Cases are going to happen. Hospitalizations are going to happen, but the biggest issue is making sure that those on the front lines who are treating these cases and preventing deaths as best as possible are not overwhelmed in doing so, because that will affect the numbers, particularly the number of people who unfortunately lose their lives from this virus.
Coming up next after the break, we'll be speaking with a cardiologist over at Beaumont, because you wonder too, you don't want it to get back to where we were back at the beginning of COVID-19, where so many people were afraid to go to the hospital. They weren't getting their checkups, they weren't getting their screenings, and in some cases people actually died from not getting the medical assistance that they needed because of their concern over COVID-19. So we'll be talking to Dr. David Haynes here. He is a cardiologist over at Beaumont Hospital just right after the break. This is the Oakland County Megacast.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. I'm Ronnie Dahl here in the studio alongside Mr. Tyler Keefe. As a reminder, you can always catch us Monday through Friday. We are here live 10 a.m. until noon. Prior or after the show, if you're unable to catch any portion of the programming, you can always check us out on civiccentertv.com, because that's where we also post the full Megacast later in the afternoon. And then also, if you check the on-demand section, that's where you'll find the individual interviews. And of course, we do rerun the show as well. Just tune us into channel 15 if you have Comcast, and 99 on AT&T. You really get concerned about COVID-19 because so many people don't want to go to the hospitals right now. But we do know that if you're suffering from heart problems, moments count, minutes count, seconds count. And so you need to not hesitate to seek medical assistance. To talk a little bit more about our healthy hearts and a study he's doing over at Beaumont Hospital, let's bring in Dr. David Haynes, a cardiologist. Thank you so much for being with us.
Thank you for having me today.
So have you seen an increase in the number of patients suffering from health issues in the middle of the pandemic?
Well, I think the major concern, as you just brought up, is that people are delaying getting appropriate acute care because of concerns about COVID exposure in the hospital environment. Now, in that setting, we are very, very careful in terms of separating infected patients from general non-COVID patients, and everybody in the hospital environment is very attentive to hand washing, using protective equipment. And so in-hospital transmission is, I think, as low as it possibly can be. But what is happening is people are delaying appropriate treatment because they don't want to come in here, and that's a problem.
So, Dr. Haynes, what are some of the signs an individual should be becoming aware of that should start raising alarm bells for them?
Sure, yeah. I think that, anything out of the ordinary, chest pain, shortness of breath are the big two that get our attention, rapid palpitations, and, there are variations of those symptoms that all of us get sporadically here and there. But if this is something that is out of the ordinary, particularly if it is associated with exertion and then alleviated with rest, and it's a new problem, you need to get checked out.
So is it better to go to a primary care physician first and let them do an overall assessment?
I think that getting in front of a physician, wherever that is a good first step. If you are acutely ill, though, you need to come right into the hospital. If this is just a kind of a nagging problem that's kind of worsening over time, it's appropriate to work up in the outpatient setting, and you can start with your primary care physician for that.
So tell us more about the study that you are participating in.
Well, the study pertains to a particular cardiac condition called atrial fibrillation. Atrial fibrillation is a rapid, irregular rhythm in the upper chambers of the heart, and it's very common. Most common rhythm out there requiring treatment. It's estimated that over 6 million Americans have this arrhythmia. You may hear the ads on TV about the blood thinners, Eliquis and Xarelto and the like. Those drugs are specifically designed to prevent some of the complications of atrial fibrillation, specifically the risk of blood clot and stroke. So when a patient is in this irregular rhythm, instead of the heart squeezing in a coordinated fashion, the upper chamber of the atria are sort of wiggling, and little eddies and pools of blood can form clot. And if that clot lets loose and ends up in the head, that can cause a major stroke. And in fact, 20% of strokes that occur are associated with atrial fibrillation. So that's a big public health concern. But on top of that, AFib is a very symptomatic rhythm for some people.
So with that, how much of this is genetic and how much is to lifestyle?
Mostly the latter, mostly lifestyle. In particular, obesity is a big problem. excess alcohol is associated with atrial fibrillation, but it just happens even in the healthiest of people. Actually, long-distance runners have a higher than normal prevalence of AFib. It's thought that the stretch of their heart during exercise may contribute. So it really hits all walks of life. Yes, there is a genetic component. If you have two parents with AFib, you're about 5.5 times more likely to have AFib than the general population. But like I said, it can affect anyone.
So if someone is concerned, what is the screening process like?
The common symptom that people have are feelings of irregular heart rate. Now, that's really common, and I would say that 95% of those people have entirely benign conditions. So if you're feeling occasional palpitations, again, a very common symptom and almost always benign. But some of those patients do have atrial fibrillation. Again, older age, high blood pressure history, any kind of heart condition predisposes people to this. If they have sleep apnea, that's a bad problem and often can trigger atrial fibrillation. But if you have irregular heart rhythm symptoms, your doctor will prescribe a heart monitor. Now, one of the ways that we're finding patients in the modern era, which is amazing to me, is the use of the Apple Watch or home pulse monitoring devices, plethysmography devices like the Fitbit watch. And these things have programming that pick up the irregular pattern of AFib and will actually alert patients to the possibility of this rhythm. So now we're seeing patients who may be entirely without symptoms, but they come in and say, hey, my watch says I have AFib. And we are picking up those patients as well.
Technology really is amazing right now.
Yeah, it really is great. And, I honestly, I was a little worried when these things started catching on. I thought my clinic would be overrun with people coming in saying, look what my watch told me that I had. Actually, it's just the opposite. We all feel funny things. We all have anxiety. Is there something wrong with my heart? And having the heart monitor right at home allows you to reassure yourself, my heart rhythm is normal. It's okay. I'm okay for today. And so that's actually lessened the prevalence of worried people with normal hearts who used to come to my clinic. So it's a good thing.
Dr. David Haynes with us here on the Megacast. He is a cardiologist for Beaumont Hospital. What do you hope to learn with this study?
Well, so when you have a patient who has enough AFib that it's impeding their lifestyle, or maybe they're just concerned about the potential long-term complications related to AFib, and there are things associated with AFib, including cognitive decline like Alzheimer's, heart failure, even or an increased risk of dying. So people who want aggressive treatment often turn to me and my colleagues, and we do a procedure called catheter ablation. And this is a procedure where we put wires in through the veins up into the heart, and we go over to the left atrial chamber, and we go into the region of the pulmonary veins, which is the source of probably 90% of the triggers that get AFib going. And in particular, if you've got an otherwise normal heart and you've got bursts of AFib, and particularly if they're symptomatic, this catheter approach where we kind of burn out the source of the AFib is a great option to offer. We've been doing this for a number of years, but I tell people it's a good procedure. It's not a great procedure. It's good because when it works, you're done with AFib. It's not a great procedure because it doesn't work in everybody. And there are a small but some risks associated with it. This new technology that we're using is called pulsed field ablation. It again, uses catheters in the heart, but the way that we affect the tissue uses a different energy form. It uses a very high voltage electrical shock almost, and it actually shocks the tissue and it kills off the area that's causing the problem. And compared to the standard approach, which is radiofrequency or cryoablation, a couple of different technologies, this appears to be safer, more effective, and faster. It's a win-win-win. And of course, we are in the trial to prove these points, but all of the extensive work leading up to this trial has really demonstrated this as being probably a superior technology to what we've been using. So we're excited to be one of the lead centers in the world offering this to our patients.
Dr. David Haynes with us here on the Megacast. He's a cardiologist over at Beaumont Hospital. And doctor, if I can ask, is there a typical age range that AFib typically will impact certain people, or could this be all over?
Well, my youngest patient was actually 17 years old. Wow. That's highly unusual. It's more common in older folks, but the demographic of patients that usually come to my clinic are people, in their middle age, in their 50s, maybe 60s, on up into their 80s. We do offer this procedure to older, healthy people. There are a lot of really fit and healthy 85-year-olds walking around out there that are bothered by the AFib. So we don't consider age as a reason not to offer the procedure. So it does tend to gravitate more to the younger population though.
So if someone is interested in the study, are there certain demographics or dynamics that they must fit in order to be a participant?
Well, to participate in the trial, this has to be, they cannot have had a failed prior procedure, and they have to go through the first tier of attempted treatment. And we do have medications that have effectiveness against this rhythm. So if you have seen your doctor, you've had documented arrhythmia, you've tried a drug like flecainide or Rhythmol or Sotalol, one of these drugs that are meant to suppress the AFib, and it didn't work or you didn't tolerate it, then absolutely you are a candidate for this trial.
This really is fascinating, the body and the heart, how it all comes together.
Yes.
It's such an amazing organ. Have you been able to see more patients or fewer patients? What's been the relationship on the heart from COVID-19 standpoint?
We actually did a large study, actually the largest study to date, looking at the changes in the electrical properties of the heart in response to both COVID and in particular hydroxychloroquine, azithromycin antibiotic treatment. You may remember the controversy about a year ago when some people were saying this is a great treatment, others were saying it's ineffective. The key thing that bothered us is that it's a potentially dangerous combo in a small subset of patients. So we actually tracked all of the patients coming through our hospital receiving these drugs and looked at their heart rhythms and their EKGs every day. My fellows, the team that did this was fantastic. We were, first of all, not surprised to see significant EKG changes, but we were alleviated that there was no high-grade rhythm problem associated with the use of these drugs or with COVID. And that's a surprise because COVID is such a devastating disease. But it really hits the lungs really hard. And of course, people with pre-existing cardiac conditions, that's a big stress. But the cardiac aspects of the disease seem to be more secondary to the lung aspects of the disease. Now, what we don't know what we're all concerned about is, will there be late manifestations of the disease that affect the heart? That is to say, patient had COVID, got sick, got better, went home. Are they going to show up in a year or 10 years with new changes to the heart muscle or to the arteries to the heart that may have been induced with the COVID infection? So we're learning new things every single day about this infection.
We're talking with Dr. David Haynes with us here on the Megacast. He's a cardiologist at Beaumont. Doctor, just another minute or two with you here on the show. Before we say goodbye, anything you want to share with the listeners and viewers that maybe we didn't ask you, because you are the expert?
Well, of course, I spend a lot of my time working with heart rhythm patients and in that regard, atrial fibrillation patients. And everybody wants to know how to treat it, but what we really want to know is, how do you prevent it in the first place? It would be best, and there may be a day where I'm out of business because there are no AFib patients out there. That would be the best. So what can you do? And it gets boring, but it's the usual stuff, the heart healthy lifestyle that's got tremendous effect in terms of preventing a number of heart diseases, including atrial fibrillation. And with the obesity epidemic, that's really sent the AFib numbers through the roof, because fat accumulates around the heart and actually has a direct irritating effect on the heart and can cause the arrhythmia. So keeping your weight in check, trying to get down to ideal body weight, and that helps high blood pressure, which reduces arrhythmia risk and cardiac disease overall, reduces diabetes risk, and that helps across the board. So, normal cardiac recommendations of a heart healthy diet, low carbohydrate, regular aerobic exercise, these are all critically important to arrhythmia prevention and general cardiac health.
Is this a condition that someone can live with and manage?
Yeah. We have many patients who conventional treatments don't work. They don't want to do the ablation, and so we leave them in AFib. And some of them, many of them, are completely asymptomatic, and so long as they take their blood thinner and they're protected against stroke, they live happy, fulfilled lives without difficulty. But there are some patients who do get into trouble after years with atrial fibrillation still.
And the really big thing for everyone out there is, do not delay getting medical help.
Right, absolutely.
Dr. Haynes, we so appreciate your time.
Okay, well, thank you for having me. I enjoyed talking with you today.
So when do you expect to have the results of the study?
Well, we have just started the pivotal phase. 400 patients need to be enrolled around the world. I anticipate we'll get through that group in about 3 or 4 months. And then we've got a year of follow-up before we analyze the data. So we're talking a couple of years before we get the final answer, but we're looking forward to that.
Well, good luck with the study, and thank you again for your time this morning. We appreciate it.
Okay, my pleasure.
Dr. David Haynes with us. He's a cardiologist at Beaumont Hospital. We're going to take a quick break here on the Megacast, and when we come back, we'll be heading up to East Lansing, talking with about recovery, alcohol recovery and drug recovery for students on the campus of Michigan State University. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Great to have you with us on this very, very chilly April the 1st. What a wake-up call.
Yeah, definitely a wake-up call. Keeps you on your toes when you're walking outside and get a rush of freezing cold air.
It took me a while to defrost my windows this morning because of the ice.
I was pleasantly surprised I didn't have any on my window. I couldn't believe it this morning. As I'm driving down Maple Road toward the West Bloomfield area where our offices are, I was frankly surprised to see snow on the ground because there was nothing in the parking lot of my apartment complex.
I saw someone did post, I think they lived out in Sterling Heights. They had like 2 inches.
Oh.
Crazy. But it's going to melt. It's opening day here in Detroit.
Yes.
Spring is with us, and hope is on the horizon. And one thing that is so good about the community is that I do think with the pandemic, Tyler, we are starting to really open up to talking about mental health issues, substance abuse issues, and so forth. Did you know that 1 in 6 students between the ages of 18 and 24 have some type of substance abuse problems that they are dealing with right now?
No, I didn't know that. The numbers, it's not surprising that they have increased over the course of the pandemic. That is still a staggering number, 1 in 6.
To talk a little bit more about this and the help that is being provided to so many students on the campus of Michigan State University, let's bring in Dawn Kepler. Dawn, thank you for being with us.
Good morning. Thank you so much for having me. And I appreciate that wonderful intro and the important background on why substance use disorders and bringing attention to them in the mental health realm is so important.
So what's it been like for you and members of your team over the past year?
It has been a challenging year. So for our students, isolation, even before the pandemic, has always been a huge risk factor. It's a huge risk factor for a lot of individuals who are navigating recovery from a substance use disorder. And particularly for our students, that's been the #1 reported risk factor. And so now that we are in the pandemic where physical distancing is a recommendation and something our students are practicing, it has also created more disconnect for our students where it's been more difficult for them to feel connected to a lot of the resources and supports that have worked so well for them previously in their recovery. And so they've really been struggling to find new ways to get supports that they need in order to have a healthy mental health and a healthy recovery journey.
And so with that, because we do know it can be tough to be a college student because there's such a big adjustment when you go to a big university such as Michigan State University, the first year and the second year. But now you throw the pandemic into the middle of it as well. It adds to the stress.
Yes, and that's a really great point. I'm glad you brought that up because research has told us that students in recovery are marginalized and underserved students. It's an underserved population on college campuses. It's not just at Michigan State, where, as you mentioned, we are a huge campus, which has both its positives and its challenges. So One of the amazing things that we have at MSU is a broad range of resources for students. And at the same time, it can be difficult to get the resources student needs, specific student needs to that student. Because we are so large and we have so many resources, students can get inundated with information, and it can be more difficult for them to pinpoint the exact resource that they need. In addition to that, substance use disorders do not have the same level of awareness and understanding as some other mental health disorders. So for depression, for example, and anxiety, those are mental health disorders that luckily have brought much more awareness, and people are learn to recognize the signs and symptoms and when to reach out for help. And it's not quite at that same level yet for substance use disorders. I am hopeful, and I think we've made some great strides in getting there. I think we have a little ways to go. There's still the stigma involved, as well as misperceptions around substance use. And you also mentioned about how on a college campus, it can be a difficult environment. And research, some people have also called college campuses a recovery hostile environment. So adding in the stigma, the marginalization, there's also historically been an environment on many college campuses where many people view a college campus as a party environment, a party culture. Here at MSU, we've worked really hard over the last few decades to combat that image. And our data is showing that we are succeeding, and we are bringing down use rates. On our college campus at MSU, according to our National College Health Assessment, we have almost 30% of students who report not drinking or using other drugs in the past 30 days. And so a lot of people focus on, and attention gets put on, that 70% or so students who are engaging in alcohol use. And a lot of times it's at, according to our data, it's at a level that is low risk. It's not the high risk use that we often associate with college environments. And at the same time, I like to put the focus on who are these 30% of students at MSU who are not drinking, have not consumed alcohol in the last month. And our students in recovery are obviously a small proportion of that. And there is also a much greater population of students who are looking for sober alternatives. They don't want to go out to the bars on St. Patrick's Day. One of our biggest events for our collegiate recovery community every year is our sober bowling event that we have on St. Patrick's Day. And we often get hundreds of students who come out who have no previous connection to the collegiate recovery community, do not identify as being in recovery themselves, but are just looking for opportunities to connect with other students in a meaningful way that doesn't involve alcohol.
Dawn Kepler with us from Michigan State University. And Dawn, can I ask you, are you worried about some of the students that are remote right now because of COVID-19 having a relapse because they don't have that support system right in front of them?
Yes, and this is something that at MSU and nationally data has come in showing that relapse is something that is increasing during this time. And so it definitely is a concern. It's something where we, as a collegiate recovery community with our own student community, have been finding as innovative ways as possible to reach out to students, because this pandemic has been difficult. It has been really hard on our mental health, everyone's mental health, particularly people in recovery and our students. And so we have been trying to approach it from a very flexible and place of compassion for our students, and understanding this is a really difficult time for their mental health. And consistency is what we've heard from our students, is that a student may return back to use, and they want to make sure that there is still a consistent resource that's there for them when they are ready to return to supports. And so this is not only for students who may have returned to use, but also for students who just have felt really disconnected, who may still be maintaining their recovery, They may be working on their mental health. They've just felt really disconnected for a number of reasons. We have students who have screen fatigue, has been a huge issue. At the Collegiate Recovery Community at MSU, we have returned to hybrid services whenever possible. And so since the beginning of fall semester, whenever safety guidelines have allowed us to, we have provided opportunities for students to have peer support group meetings in person as well as virtually in a hybrid format, following all safety guidelines, as well as other activities, many of which have been outdoors to make sure that we can be as safe as possible with physically distancing. And so we have been trying to think outside the box and reinvent services that are based on research and our best practices for our students, and we know have worked for a long time now. And so finding new ways to provide for those needs, because we know our students are struggling right now.
And with that, I know that your organization is also working with the Jamie Daniels Foundation. Mm-hmm. We had them on the show a couple of weeks ago, but tell us more about that relationship.
Oh, thank you for bringing up the Jamie Daniels Foundation. We are so incredibly grateful to all the work they are doing. They are so supportive of our collegiate recovery, first and foremost, and also they are doing amazing work using their platform to be able to talk about the stigma and the silence there often is around not only those who are struggling and navigating a substance use disorder and those in recovery, but also the families and everyone else who is affected. And so we also love the support that Jamie Daniels Foundation, also in collaboration with the Children's Foundation, has offered to our students. Our program involves on-campus recovery housing, which is the first in the state of Michigan. And so we were so blown away and amazed when, after our pilot year, when we had some amazing results, and we were looking at this and saying, how do we continue this? How do we make this a sustainable program? Because we've seen the impact, we've seen the need, the outreach from other students who have sat across the country who have contacted our program and said, we need a place where there's on-campus recovery housing, as well as the other collegiate recovery supports that you have available. And so at that point, Children's Foundation, along with Jamie Daniels Foundation, approached us and said, we love what you're doing. We want to support you. How can we support you? And that's when we were able to help continue our recovery housing program through the support of Jamie Daniels Foundation and Children's Foundation, supporting our living in position for our recovery housing support specialist. So we have a student who's been trained to support their peers, who lives right in the same hall as our students who live in recovery housing. And so that's been an amazing experience for our students, particularly those who are new to recovery and who are learning how to navigate on a college campus, staying sober. And so we are so appreciative to that. We also have been able to recently developed the endowment for the Jamie Daniels Memorial Scholarship, which has been an amazing support for our students in recovery who often come to college either having already them and their family spent money on treatment, or some of our students are not the traditional student age. Some of them have other things going on in their lives where they don't necessarily have the same capacity for paying for college. And so having those scholarship opportunities and financial support has been huge for our students. And on top of that, the Jamie Daniels Foundation and Children's Foundation have also worked with us and been flexible in acknowledging the hard difficulties that students have had to face over the pandemic. And so they've helped us to be able to offer COVID emergency funds for students who've had to drop everything and move out of state because a family member had COVID. We've had students who've had to put all of their living furnishings into a storage unit and having to figure out how to pay for a storage unit and an apartment that they no longer live in. and go home and help their family. And we've had students who have lost jobs over the course of the pandemic. And so having these financial supports available has been huge for students to continue to be able to engage in the resources that they need.
Because when they have the resources, have you found it in some cases has helped them stay on their sobriety path? Because that additional stress, sometimes it could be the smallest thing that sets them off their journey.
Yes, that's such a great point. I'm glad you brought that up. Because students in recovery are some of the busiest students you will ever meet, because they are not only doing amazing in college and with their coursework. Our students who are part of our collegiate recovery community are some of the most successful students on campus. Our most recent survey showed that 100% of our students in the CRC had a cumulative GPA above a 3.0 and 50% had a 3.5 or above. And so our students are really dedicated to their academics. Having a job on top of that takes a lot of time and effort, and most of our students do also work. And in addition to that, having a healthy self-care recovery program takes a lot of time. Our students take time to go to multiple support meetings every week. They take time to go to a therapist. They take time every day to work on mindfulness and meditation activities and breathing and coping tools that they've learned. And so while that helps them to be more efficient and effective, it also takes time. And so any opportunity to support those extra supports and resources, either financially or allowing students to not have to work as much so they can put more time and energy into their recovery supports, is really key for our students. We're already juggling so much as successful college students.
Dawn Kepler with us here on the Megacast. She's the Collegiate Recovery Community Coordinator for the Michigan State University. And with that, Dawn, what are some of the signs people should be looking for if they are concerned about one of their loved ones?
Yeah, that's a great question. And so I mentioned earlier isolation and being disconnected. And that's something, those are the two biggest red flags that we often see with our students in the collegiate recovery community who are in recovery and may be struggling. And so I think it's a little bit different depending on which population you're looking at. If you're looking at a student that's already navigating recovery versus someone who is engaging in a full-blown active substance use disorder. And so, but some of the kind of common things to look for is inconsistencies, a student who is not doing as well in something that they were previously passionate about, or not engaging in something that they were previously passionate about, looking out for just differences. So there's always kind of that gut feeling when you see someone and they don't look like they are taking care of each other. And that's what's been so difficult about the pandemic, is we often don't get that face-to-face time. We're on the phone or Zoom where things can not be as apparent. But seeing that someone isn't showering or is not getting dressed or is not taking care of themselves in the same way. And that's what's made this pandemic extra challenging, is that many of those things we look for are things that students are kind of naturally doing already because they don't leave their apartment as much. So why would you have to change out of your pajamas or get dressed or do your hair, because who's gonna see you? And then the isolation and disconnection piece is already something that they're struggling with, which makes it so incredibly difficult right now of all times to be able to look for those common signs that we often see.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. We're speaking with Dawn Kepler, Michigan State University. You've done so much work to try to help these students on their path to recovery. It's been a challenge, but how can someone out there that may be listening or watching, how can they find out more information about the services that you offer?
Thank you for bringing that up. So we have our website at MSU Health Promotion, where you can look up our services. You can also follow us on Facebook, Twitter, and Instagram. We love the support. Our students love the support. Our students help us with our social media accounts. So anytime someone follows us and likes one of their photos, they're always so excited. So we appreciate any and all support that anyone wants to give to the collegiate recovery community and our students.
And so much of this is about having the conversations and switching the dialogue and the wording that we use around drug addiction and alcoholism. We need to treat it like a disease like we do cancer.
Exactly, yes. I think that's such an important point, and part of what we love about our partnership with Jamie Daniels Foundation is bringing the awareness and understanding that addiction and the substance use disorders are a chronic brain disease. And it is covered under the Americans with Disabilities Act as a disability. And as we've learned with work with other disabilities and diseases, it's really important to use language that is not stigmatizing, and particularly person-first language. So we don't want to call someone a substance abuser. We want to say that they're a person with a substance use disorder, that person first, or a person in recovery. We say that they're a person first. We don't allow their mental health condition to define them.
Dawn Kepler with us on the Oakland County Megacast. She's from the Michigan State University Collegiate Recovery Community. And Dawn, with that being the case and everything we've spoken about, if a student does come to the realization that they have a problem or that they need some help, how can they reach out to the recovery community and get involved there?
Yes, thank you for bringing that up. So we have a lot of opportunities. We have events and activities typically all the time. We have standing meetings. So every Thursday night at 7 p.m. we have our all recovery meeting for our collegiate recovery. And we also have opportunities to try to get students connected with their peers immediately. So we want them to obviously talk to me as the collegiate recovery community coordinator. I meet with most of our students one-on-one and help them with their goal planning and some recovery coaching. And we also try to connect them immediately with their peers, so then they can have a community where they can get that peer support. And students can really help give them that student perspective as well, that we find is something students are often looking for. For our student population, about 79% of them usually hear about the collegiate recovery community after starting at MSU. We do have about 20% of students who found the collegiate recovery community before coming to MSU, and some of them actually said that they would not be enrolled in college or at MSU had it not been for the collegiate recovery community. And so that's why our work with Jamie Daniels Foundation and Children's Foundation and you inviting us on the show is so important, because we recognize that there are high schoolers and there are other college students across the nation who are looking for safe, supportive space on a college campus. And so we appreciate you inviting us on and giving us this opportunity to help raise awareness of the collegiate recovery community and the services and supports we offer to students.
Well, it's so great that you're able to offer that support as well, because we know recovery is a day-to-day process and it's about support. So thank you, Dawn, again for your time. We so appreciate it.
Yeah, thank you so much. And I hope you have a non-snowy, hopefully pretty soon sunny April Fool's Day.
Right, exactly. Dawn Kepler with us, Michigan State University. We're going to take a quick break here on the Megacast, and when we come back, we're actually going to continue this conversation talking about our wellness with Dr. Melanie Schwartz. This is the Oakland County Megacast.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Welcome back to the Thursday edition of the Oakland County Megacast. I'm Ronnie Dahl here in the studio with Mr. Tyler Keith. As a reminder, you can always catch a Civic Center TV, Birmingham Area Municipal Access if you have cable. You could check us out. Channel 15 is where you'll find us if you have Comcast, 99 on AT&T. You can also listen to us on the radio, 89.3 Lakes FM and 88.1 FM, the Biff. And then we also want to say thank you to Oakland University today for allowing us to live stream today's edition of the Megacast on their Facebook page. We are a year into the pandemic. It has been a roller coaster ride, and we are not done with this ride just yet. To talk a little bit more about all of the feelings and how so many of us are trying to manage throughout the pandemic, let's bring in Dr. Melanie Schwartz. She's a licensed clinical psychologist and the owner, Viewpoint Psychology and Wellness. Doctor, thank you for being with us today.
Thank you for having me.
1 year into this, how are you doing?
I'm doing okay, but you used the right word, roller coaster ride. That seems to be the word that words that seem to come to mind when talking about the last year and ongoing into the future too.
Because it's like we go through these emotions where you get depressed, but then, something will happen or the sun will shine and you get outside and you get hopeful again. But then, it crashes as maybe someone that gets diagnosed with COVID or the surges that we continue to see. How important is it for people to take a break from all the outside influences and the talk and the chatter to try to manage their feelings during this pandemic?
Extremely important, because we're getting information from every which way, whether you're watching TV, listening to the radio, social media, your computer, wherever it's coming from, that's all we're hearing about. And it's a lot of information, and some of it's conflicting information, and it just creates a lot of anxiety. And over the last year, it's created hopelessness and depression and anxiety and anger and you name it, the emotion, the feelings, they've been there. And so taking a break is extremely important because it gives you time to just be mindful and focus on the present and not the future or the past or the last year, just being in the moment, which is really good to kind of calm down your mind.
I wonder if all those months ago, if instead of saying, hey, we're going to close things down for 2 weeks, if someone would have said, we're going to start with 2 weeks, but this could be going on in a year, if that would have impacted how some of us were dealing with our feelings and the emotions throughout the pandemic?
That's a good question. I honestly don't know, because, if somebody had said this was going to be going on a year later, that may have created a lot of hopelessness a lot earlier.
Yes, that's true.
In a lot earlier. But, we're also, again, it goes back to that roller coaster mentality of, we get our hopes up and then we're disappointed, and then we get our hopes up and then we're disappointed. And it's a constant roller coaster. I just keep using that word, but that's what it's doing for us. But at the same time, the hopelessness tends to be short-lived while we have some hope, when they say things are getting more under control or the numbers go down for a while. So it helps us kind of pull us out of the depression, hopelessness for a little bit. Even if we go back into it, I think is better than being in it continuously.
Dr. Melanie Schwartz with us here on the Megacast. She's a licensed clinical psychologist and the owner for Viewpoint Psychology and Wellness. We were just speaking with Dawn Kepler at Michigan State University about how some of their students are handling this that are in recovery, which can make things even more challenging. But we have so many kids here that are still struggling, even though they're back in the classroom.
Yes.
How long? You know, they could go remote once again. So what should parents know a year into this to try to help navigate and guide their kids?
I think they just need to be aware of what to look for. I think they need to look for whether their child is isolating, whether their child is talking about feeling sad, about wanting to, quit activities, extracurricular activities, if their grades are dropping, they're unmotivated, if they are noticing that they are more anxious or worried about things that they normally wouldn't be. So just being self-aware, unfortunately the suicide numbers have been on the increase over the past year largely. And so, watching out for symptoms of extreme depression that could lead to suicide, and making yourself aware, whether you look up the symptoms online, you talk to a professional, you talk to the people and in your child's circle, whether it's friends, parents, teachers, making sure you're staying aware of what's going on with your kids.
And it could be so hard with teenagers. How do you know when they're just being teenagers and they're moody, and when they're actually in the need of help?
Yes, this year it is extremely difficult to tell the difference between the two. And, we're seeing a lot at my practice that parents are erring more on the side of caution and bringing their kids in, even if they're unsure, just to let a professional make the determination of whether their child needs help or not. So, I guess at this point, I would probably make that recommendation. If you're concerned, talk to a professional, okay? And maybe let the professional assess your child just to determine if you're uncertain whether there is a problem or not.
Because it's better to be safe than to wait too long.
Yes, absolutely.
So what has been the impact when we're talking about parents and their kids on other kids? Because we rely on going to school, and the teachers are often on the first lines, sounding that alarm bell when it needs to go off. But now I feel like some of the pressure is being put on their friends to maybe be the ones that notice those changes first. And then the friends, because a lot of them are still young, they are teenagers or even 10, 11, 12-year-old. They don't know how to ask for help for a friend.
Right. To be honest, yes, teachers are often the ones who can see what's going on with the kids, but more often than not, the kids are the ones who point it out to other kids. One of my specialties is working with adolescents, and more often than not, I'll hear them talk about how they're concerned about one of their friends and what should they do and how should they handle it. And, we talk about how they can reach out to their teachers or counselors or even the parents of their friends if they feel comfortable doing that, that they should never try and handle it on their own, that they should always get assistance from an adult.
We're talking with Dr. Melanie Schwartz here with us on the Megacast as we are a year into the pandemic, and we're hoping that we're on the backside of it with a vaccine. But we also know that there are going to be so many long-term impacts coming out of this. We're never going to go back to life like we once knew it. We can't erase COVID-19 and this past year of experiences, but we've had so much focus on the kids. What about the parents? Do you think sometimes the kids are better to adapt to change than what we are as adults?
Generally speaking, kids are more resilient than adults are, but I think, the kids, unfortunately, were hit in such an extreme way this last year that I don't know that parents versus kids who had it worse, depending on, their circumstances, because the kids, our adults, our whole lives changed as well in one way or another, but kids, their lives were turned completely upside down. And kids really thrive on structure and being able to know what their day looks like, what their week looks like, what activities they're going to, if they have to go to their after school job or, hang out with their friends, whatever that looks like. And that was completely taken away from them. So I think they probably experienced more loss than we did. And so I think they actually is equally a difficult time, if not more.
So what are some of the coping measures that you would say could it benefit the parents and the kids to help get us through this time?
Well, I think having open dialogue and conversations about how they're feeling and what's going on for them or, just in their daily lives is very important right now. It's very easy to keep things in. We've been dealing with this for a year. And I think a lot of people, kind of think, well, what am I going to talk about? It's been the same thing for a year. It's not changing. This is just how I feel. But when you don't talk about it, then it builds up and then the symptoms increase for you. So definitely talking about it, making sure, we've been very lucky. The weather has gotten fairly nice, fairly early for us in Michigan. So making sure you're getting outside, getting sunlight, making sure you're exercising, whether you do it individually, do it as a family, do it with your friends, making sure you're still socializing, whether, you're allowed to do it in person or if it still has to be over technology, making sure that you are not isolating. These are some of the things that are really, really going to get us through.
Dr. Melanie Schwartz with us here on the Megacast. I know that you are also a part of the West Bloomfield Police Department's peer support team. We had Kurt Lawson a couple weeks ago talking about the program, but tell us more about it and your role in the peer support program.
So my role, I've been brought on as the mental health professional for the peer support team. So my role is to be a consultant for the peer support team to the members of the team. After they speak to one of their colleagues and they feel that they need additional support, then they're going to reach out to me to see what I recommend. If I suggest that they would need additional services, therapy, or whatever they may need, and who I would recommend, where I would send them, or they may even want me to speak with one of the members of the police department as well to make my own assessment and get my own perspective. So that's my role, and also to help them with training periodically throughout the year to keep them up to date on what they need to know to help their peers.
This is so great that they're starting this program because for years, decades really, when it comes to law enforcement, there was a code of silence around mental health issues. So how important do you think it's going to be for the profession overall to start to have some of these programs?
Extremely important. I am so glad that West Bloomfield decided to do this. These programs have gone on for years throughout the United States, even out of the country. So now that they're starting to develop in the country and Michigan, several of the departments around here do have peer support teams, which is great. I think just breaking the stigma of mental health and just being able to have someone to talk to and vent if you feel like that's what you need to do instead of keeping it all in, which is kind of the mentality of a police officer, to present as there's nothing wrong and I can handle all of this, which is not the case for anyone because everybody has things that they need to talk about and deal with. So just having that peer that you can go to is going to make a huge difference.
And getting them to open up, because we do know that suicide rates and alcoholism and substance abuse is high amongst some of our first responders.
Mm-hmm. Yes, absolutely. Those are some of the main reasons that the peer support team was developed, so that we can increase the the physical and mental health of the department and increase the morale and just their ability to be productive at work as well. Because, when they're not sleeping great and they're not eating and they're engaging in unhealthy coping skills, then, they're not as effective as they could be. So being able to improve their health in different ways is definitely going to make a difference for them.
so many law enforcement officers and our first responders, they see and deal with so many tragic events and situations. So it's so great that they're going to start getting this help. And let's hope that it does start to change the dialogue and people are comfortable using these services as well. Just another minute or two with you here with us. Dr. Melanie Schwartz with us. She's a licensed clinical psychologist and the owner for Viewpoint Psychology and Wellness. Hopefully, we do have more and more people are starting to get vaccinated. Unfortunately, we are also in the middle of another surge here in the state of Michigan. But as more and more people get vaccinated, do you think that people are going to be more comfortable going back out in public and out in public without a mask?
Yes, I do. I think that is everyone's hope, is that the vaccine is going to eventually, if enough people get the vaccine, that the ability to go out and do things in a safe manner with or without a mask will make a difference. It's definitely decreased anxiety for a lot of people, myself included. I've been vaccinated and I was able to go back to my office a couple days a week, which I haven't been able to do for a very long time, and feel comfortable being able to do that and see people in person. So definitely it's going to make a difference, decrease anxiety, and hopefully get people feeling like things are a little bit back to normal. Not completely, like you said, it's going to be a very, very, very long time before that happens. But I think just that feeling or little feeling of relief that you feel more safe than you did makes a huge difference.
Dr. Melanie Schwartz with us on the Oakland County Megacast. And Dr. Schwartz, as we are getting to that point, and as we do unmask this pandemic over the course of time, as the vaccine process gets us closer to that herd immunity point, what should we be cognizant of as we do get back to some semblance of normal, whatever that is after this pandemic, and begin to socialize again and begin to go back out as we regularly did pre-pandemic? What should we be more cognizant of and respectful of when interacting with other people? Because all of us are going to come out of this at a different pace.
Yes, we are. And I think that's it, is to do this slowly and, in a respectful way, because we don't know who's been vaccinated and hasn't been vaccinated. And we don't know we don't have a lot of answers about the vaccine yet as well. So, I know everyone wants to rush and go back to normal and everything open up and just resume life as it used to be, but then we're risking safety once again. So I think it's just slowly test out the waters, and, you have to ask questions and say, do you feel comfortable, going to a restaurant? Do you feel comfortable wearing your mask or not wearing a mask around people? Being respectful in stores where you still do have to wear a mask, and that's okay. Just be respectful of it, because everyone is at different levels of where they're at emotionally and whether they've gotten a vaccine or not. So some people are at a safer level than others too. So just take things slowly, step by step, and we'll get back there. It's just going to take some time. So patience is going to be key.
Such great advice. It's always great to have you with us here. We appreciate your expertise and your knowledge.
Thank you very much.
Dr. Melanie Schwartz, she's a licensed clinical psychologist and the owner of Viewpoint Psychology and Wellness. We're going to take a quick break here on the Megacast. When we come back, it is Autism Awareness Month that starts today, and we'll be speaking with the director for the Joanne and Ted and Lindsay Foundation Autism Outreach Services over at Oakland University when we come back after this break.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you with us on the Megacast. I'm Ronnie Dahl here in the studio alongside Mr. Tyler Keefe on this first day of April, opening day in the city of Detroit.
Yes, opening day, an exciting day. We're so excited we have chills. It's also the weather, but it's mostly excitement.
It's the weather, because we know the Tigers aren't going to be good enough to give us chills.
They're going to have a lot of cold spells this season, so it's on point.
But you know what today also is, with it being the 1st of April, it does start Autism Awareness Month, and sadly, the CDC reported that about 1 in 54 children here in the United States is diagnosed with an autism spectrum disorder, and that's according to 2016 data. So many people need so much help, and I've wondered and worried about so many of these kids throughout the pandemic, because when you look what we're going through as adults. And for people who could be on the spectrum, it can be especially difficult to adapt. Talk a little bit more. Let's bring in Kristin Rohrbeck. She is the director for the Joanne and Ted and Lindsay Foundation Autism Outreach Services over at Oakland University. Thank you for being with us, Kristin.
Thank you so much for having me.
Tell us first more about the Center for Autism over at Oakland University.
Thank you. Yeah, so the Oakland University Center for Autism is a great resource for the autism community and our general community in our region and beyond. We are made up of our outreach services, of which I'm the director, and we have got great programs for people on the spectrum of all ages. We also have a really robust research agenda and an ABA clinic, which is applied behavior analysis for younger children on the spectrum who need clinical therapy, clinical ABA therapy, as well as a very strong program for professionals who want to take academic programming to become professionals who work with people on the autism spectrum as their job. So both educators and other kinds of clinicians. So applied behavior analysis therapists, for example, and others.
Since you work in this arena, what has the past year been like for some of the kids, but their parents as well?
That's exactly the main point, I'd say, is that it is having the pandemic has had a huge impact on families impacted by autism, specifically the individual with autism, him or herself. And it's important to think about young children, older children, teens, and then adults with autism as well, because there are more and more adults on the autism spectrum also. And then their parents and caregivers and how it's impacting them. So for example, people with autism typically have challenges in social engagement. And over the last year, we've all been isolated socially and had limited communication opportunities, for example. And all of our routines have been very, very disrupted. And so it's impacted everyone, but especially the autism community when they need routine, they need structure in their lives and in their schedules. They oftentimes need that social engagement and communication to improve their skills and not regress. And then on top of that, think about those adults with autism who have maybe jobs, and this pandemic has had a huge impact on them. Oftentimes, the people we work with, for example, might have part-time jobs. Some of them have full-time jobs, and they've been very impacted financially and in their ability to live independently. And then also what you were saying is very true, that parents and caregivers of people with autism have been impacted tremendously as well, because they're just trying to create and do the best they can to create the structure and the routines needed for their loved ones with autism. And it's been so hard, obviously, with changes in therapy schedules and school schedules, although what we've been happy to see is that more and more kids and adults are getting back to what those routines will look like, although nothing is exactly what it had been pre-pandemic.
Are you worried that because of the pandemic, some of the advances and improvements some of the people have been making, now they're going to be set back?
So we have seen that a little, but what's been really important is, for example, applied behavior analysis therapy is a medically necessary therapy for so many people. And that has been something that has been continued to be offered most of the pandemic. There were a few months where it was not. But there have been, unfortunately, setbacks with many people who are not in that ABA therapy. But schools and parents and families and programs like ours are doing the best we can to help people with autism continue to progress in their skill development and not regress.
So as you've been doing some of your work, what do you think is going to be some of the things that, or let me just rephrase that. So as you've been doing some of your work, what are you looking forward to in the advancement of trying to help people with autism in our community?
Definitely. So I think first and foremost, I'm looking forward to getting back to be able to safely offer programming in person. That is one of the things that we're hearing from our families. They need so much because of the social engagement aspects, just being in person and communicating in a non-contrived situation. Our families have told us how much their family units have been impacted when they haven't been able to offer their kids all of the different things that they had before the pandemic, even going to school. So I'm looking forward to us being able to provide structure, provide social experiences, and really help them to continue towards independent living, towards more social activities, more sporting activities, things like that we offer through OUCARES as well.
Any advancements being made right now in the therapy of autism that you're excited about?
So ABA therapy, that applied behavior analysis that I mentioned, is the gold standard for therapy that is offered, behavioral therapy that's offered for people with autism. More and more people are getting trained in the field, and there are more and more mental health professionals as well that I think that's a huge piece, that are being trained in autism spectrum disorder, because many people with autism often also have a comorbid diagnosis. So whether that might be depression or other kinds of things, it's very important that in addition to behavioral therapy, which people with autism often need, there are also other mental health professionals that are trained and able to meet all those growing needs of the autism population.
Kristin Rohrbeck with us here on the Megacast. She's the director for the Joanne and Ted and Lindsay Foundation Autism Outreach Services at Oakland University Center for Autism. Kristin, can we talk a little bit about some of these therapies? Does healthcare help pay for a lot of the therapy so that those that need it can get the help that they need?
So there are a lot of different therapies that people with autism spectrum disorders might need. It could be speech. Sometimes it's occupational therapy. Again, like I said, the gold standard for behavioral therapy is applied behavior analysis. But there are a number of different kinds of therapies. And we're really fortunate that in the state of Michigan, especially, our legislators have pushed forward law that have made ABA, that applied behavior analysis therapy, able to be covered on insurances up till age 21. And that's a huge win for our state and the autism population in our state. But like I said, there are also other therapies such as speech, occupational therapy, physical therapy sometimes is needed because of the autism diagnosis, or sometimes even comorbid diagnoses. And those can also be often covered by insurance.
So how did you get into this line of work? You're very passionate.
Thank you so much. My background is educationally in psychology, and I had worked in my graduate career with young people with autism, and I had done research with young people with autism. And the more and more I worked with those individuals as a therapist, I my passion grew, and I realized that I needed to work with families with autism. I needed to do something where I could help make a difference and see the impact that I was making on our families. And so that's why I got into the field. I continued the way that I have been, and I've been so fortunate to be at Oakland University, where autism and helping the autism population is a top priority. And our Center for Autism, as I mentioned, OUCARES has been around since about 2004. I've been lucky to be here since 2012, and we've grown quite a few autism services and supports since then, especially for teens and adults. And so I just, my passion just grows to continue to help the families, because the people who were accessing our supports and services when I began here, for example, in 2012, are now growing. Autism is not a disorder that people grow out of. And so they're still needing services and supports. More and more families are getting loved ones diagnosed with people on the spectrum. And I'm just so glad that I'm a part of an organization like Oakland University, where we are pushing forward these initiatives and really trying to help all of the community.
It really is so important. It's great that we have the center here, because a few years ago, we really weren't talking a lot about autism, and we also know there is a very broad definition that falls under that. So it could be hard for people in the general public to really understand the world of an autistic individual.
That's right. Autism has changed in the way that clinicians diagnose, even in the last 10 years, as new diagnostic manuals have been developed. We used to hear, for example, the term Asperger's syndrome, and many people who had been diagnosed, for example, with Asperger's syndrome, very much hold that dear to themselves, because that's a part of their identity, is that diagnosis. But Asperger's syndrome is no longer a diagnosis in the diagnostic manual. And so things have definitely changed in the field. But again, what I think the most important thing is that more and more supports like ours are continuing to be developed to offer them.
So what are some of the signs that a parent should look for? And is it around the age of 2 you're typically someone is diagnosed with autism?
Sure. So I'm not a clinician myself. However, more and more people are getting diagnosed at younger ages. Early intervention is key to having successful outcomes as they grow older, individuals with autism. We are typically seeing diagnoses in those very early years. So 1, 2, 3 years of age, it's very important to have the conversation with your pediatrician. If you're feeling like there might be some differences that might be autism or something similar, anytime you have any concerns, obviously you should talk to your pediatrician. Things that are hallmarks, for example, are not looking people in the eye, not wanting that social engagement, especially with family members, repetitive behaviors, so things like stacking toys in the line, or hand flapping, things like that are would have been thought of as typical behaviors, but it can look very, very different in different individuals. And what's really interesting as well is that more and more researchers are looking for ways that autism may be diagnosed, or characteristics might be seen for autism even earlier. So there are some studies that show in infants that you can start to see signs for getting a diagnosis later on.
So tell us more about the center. How can people get involved if they need help?
Yeah, thank you so much for asking. That's one of the most important things, is if there are families that are listening or watching that need help and resources, they should definitely reach out. Our Center for Autism's mission is to improve the quality in the life of people impacted by autism, and that's across the lifespan. They can definitely always reach out to OUCARES. There are some other really amazing resources in the state of Michigan, such as the Autism Alliance of Michigan, that has a navigator tool online. OUCARES as well is a great resource for families to be able to connect with, just to say, what can I look for? Like, what are there, for example, clinicians, or are there different kinds of supports and services in my area? What are families saying about these different individuals? and we'd be happy to share that information.
We're talking with Kristin Rohrbeck with us here. She's the director for the Joanne and Ted Lindsay Foundation Autism Outreach Services at Oakland University Center for Autism. As it is, April is Autism Month. Any special programming you have going on this month to recognize this time?
Yeah, definitely. So first and foremost, Autism Awareness Month is in April, and it's so much more than just autism awareness. We've really gone beyond that over the last few years, especially, where autism awareness is still very important. We have moved past just awareness to be all about autism understanding and inclusive practices. So we're very, very excited tomorrow for World Autism Awareness Day on April 2nd to have a kickoff to a virtual series that the Center for Autism is offering. So there's a virtual series with Brian Calley, who is former Lieutenant Governor of Michigan, now Oakland University trustee, who will be giving us a kickoff tomorrow around noon. And then on April 8th, which is next week, we have a great opportunity for individuals who are interested in learning more about the opportunities through Oakland University to become a professional who works with people on the autism spectrum, to come and learn about what it is that we offer academically through our programming. And then on April 15th, we have a really wonderful speaker coming. Her name is Tracy Cohen. She is an adult woman who was diagnosed with autism spectrum disorder later in life. And she will offer her insights into what it's been like to have autism throughout her life and get a later autism diagnosis. And then finally, later on in April, on the 22nd, we will have the director of our research area within our Center for Autism talk about recent research collaborations within our center and across institutions as well.
Kristin, we so appreciate your time, but all the work that you're doing over there as well. We know families are struggling right now, and it's so great that they have the support and the services from you and your team to help them through not just the pandemic, but also help them navigate their world as an autistic person. So thank you again.
Thank you so much.
Anything, and happy opening day.
Yes, happy opening day. Happy opening day and happy Autism Awareness and Understanding and Inclusion Month.
Thank you so much. Kristin Rohrbeck with us. She's the director for the Joanne and Ted Lindsay Foundation Autism Outreach Services, OUCARES, at the Oakland University Center for Autism. We had Freddie the Pizza Man on last week.
Yes.
Talking about autism and the work that he is doing through his foundation as well. I'm so excited to see people are starting to really try to understand autism, because I have friends that have autistic children, and for years it was hard to even get health care coverage for some of the therapies that their kids needed. So it's great to see that we are making strides in that arena.
Yeah, and more strides do need to be made. As Kristin had said earlier, a lot of these services are covered by insurance up until 21 years old, and we even mentioned in there that people are getting diagnosed later on in life, and a lot of these services beyond a certain age are not covered medically anymore, and people on the spectrum still very much need those services.
Again, check them out, Oakland University Center for Autism. We're going to take a quick break here on the Megacast. When we come back, we will be headed to the fine city of Northfield. This is the Oakland County Megacast.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful, because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services. COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services. Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Thank you for being with us on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. As always, you can catch us on Civic Center TV, Birmingham Area Municipal Access, Channel 15 if you have Comcast, 99 on AT&T. You can also listen to us on the radio, 89.3 Lakes FM, 88.1 FM The Biff. And also thank you to the Oakland University team for allowing us to live stream today's edition of the Megacast on their Facebook page. Just about 15 minutes left here in the show. Let's go ahead and bring in Lori Ward. She is the director for the Northfield Downtown Development Authority. Lori, thank you so much for being with us.
That's my pleasure.
We made it through the winter.
We made it through the winter.
Northville was so creative in coming up with those little outdoor heated spaces. Is that going to continue into the springtime, do you think?
It is. We have extended our street closures and our outdoor expanded dining until February of 2022. So our roads will not be reopening anytime soon. It'll be kept to outdoor dining, retail, and pedestrian access. So because we've made that decision, we're going to be keeping our stands and our pods for the time being, until the near future. And that allows our restaurants to expand their footprint even further by being a vendor in one of those type of stands so that they can test out new seasonal, menu items, and that they can continue to serve while they're not at full capacity on the inside of their restaurants yet.
What's been the reaction from the public?
Oh, it's been really well embraced. I mean, we have had lots of people come down and support the downtown businesses. We raised over $150,000 from our community to build the pods and the stands to support the businesses, something that we've never seen before, that kind of generous giving to make sure that they all stayed in business. They didn't want to lose any of the restaurants or retailers that they had come to feel like family. So it was a big effort, and it really paid off.
I know that you said they're looking at keeping the streets closed until February 2022, which sounds so weird to me, doesn't it? But I'm going to go ahead and throw my vote in. Just keep it, because it seems to really be beyond the pandemic, a nice way for people to engage and not worry about traffic. Although parking is always kind of an issue, but still, it really is a nice flow to that downtown area.
Well, thanks. The traffic has really not been an issue for us. We haven't had any complaints from the neighbors nearby about detours running past their home. We haven't had very many complaints about parking or anything like that. And I believe it's because it's a long-term solution, and we're posting it and people know in advance, unlike maybe a weekend special event that would close it down. They know, and they're making their decisions to route around the downtown at 5 mile, 6 mile, 7 mile. They're not clogging up the downtown with these detours. I think it's been very manageable. And so that's something that was a little bit surprising. We weren't sure how that would be received, and it really has not been an issue at all for us.
And have you found that it's attracted people from outside of Northville to come into the area?
Yeah, we get report from our restaurants and our retailers both that they are really expanding the zip code area from where the purchases are being made. Particularly the retail say that they have been seeing a lot of zip codes that are hour drive away, where people are coming in to eat outdoors, socially distance, and be able to shop and spend the day there. So it's been, I think, really a tremendous help to all the, particularly to the retailers downtown.
We're talking with Lori Ward. She's the director for the Northfield Downtown Development Authority. Every business has had to get creative throughout the pandemic to try and survive. Have you, though, had some businesses that have had to close their doors?
We have. We've had a few, and a few of them were tied to, I would say, people that were considering retiring anyway. And I think this pandemic helped them, sped that up a little bit. You know, they said, I was thinking about in the next year or two, but, I'm not going to reopen. So we've lost a couple that were probably imminent anyway. But what has really surprised me is the pace that we've been able to replace those restaurants and retailers with new businesses. We've had several businesses downtown open their second or third different business in Northfield during the pandemic. A good example is Adorn Flowers, who joined us about 3 years ago right on Main Street, and she does just beautiful work. The space next to her came available. It was a little tiny spot, and she took over the lease and opened up a candy store called Sugarloo's. And then one of the restaurants across the street from her closed, and she took over that lease, and they're opening up a new restaurant called Toria, which will be opening in early May. So during the pandemic, she opened up two new businesses that are both doing, one doing great, the other, they've already been participating in our stands downtown, so people have been able to already try their food and love it.
Since this has been so successful, have you had other communities reach out to you about how you've been able to implement this?
Yes, lots, lots and lots. We were one of the first, probably half dozen cities in the state that became a social district. And that allowed us to have the licensed restaurants with a special license, a social district license, to serve alcohol that could be carried out and around the downtown, so in designated areas. So we have two plazas, Old Church Square and Town Square. So you can pick up a glass of wine or a cocktail at one of the participating businesses and walk around downtown and window shop and sit down with a friend and have a beverage. So people are really curious as to how that's working and how to do it. I was a panelist on at a conference, the Michigan Downtown Association, on Friday, talking about outdoor dining expansion, and got a report back on Monday from some of my businesses that a lot of my colleagues from across the state had popped in over the weekend to see how it worked and chat with them about the struggles that they've faced and how it's worked and how it's impacted particularly the retailers.
Because on the backside of this, we know that some businesses are struggling getting enough employees. Has that been an issue there in Northfield?
Yes, it's been a huge issue for particularly our restaurants, and which has not allowed them to reopen for lunch. And I think that's the thing that we see the most. They're able to put a crew together for outdoor dining outside dining, but not for lunchtime. And so they're having to choose, what their hours are going to be. And I think that as we go forward into the summer, I'm just hoping that improves, steadily, so that they can all fully staff and get their employees back to work.
Yeah, it's been hard with some of the college students and high school students that sometimes would fill these jobs because sometimes they're remote, sometimes they're not sure what their schedule is, so that could be hard as well. We're talking with Lori Ward. She's the director for the Northfield Downtown Development Authority. And with that, Lori, it sounds like at least this part has been successful for the city of Northfield, because we all want that walkable community. It's almost like we're going back in time to when we were a community and we could get outside and get to know our neighbors. Do you think that this could stick around long term, that sense of community coming back?
Oh, I do. We get questions about that all the time, about whether we would consider the closures permanently. and whether it's one street or both street, whether we would do it. And so in discussions at a town hall meeting with our residents and our business owners, we said, we'll permit the licenses for one full more year, and we'll be able to see then through the pandemic another full season, each, winter, spring, summer, fall, with the street closures, and see what that impact is. We just don't know yet what the behavioral changes will be once they're reopened fully. We don't know whether those visitors that we've attracted now from Birmingham and Brighton and Lansing will continue to come if their own stores and restaurants are reopened fully. So this kind of allows us another test for a year, just to see what the traffic continues to be. And if we continue the numbers that we have now, I think we will consider some sort of permanent closure.
Lori Ward with us here on the Megacast. With that, Lori, if someone has not been to the area since you implemented this, what is their first place they should go to?
Oh, gosh. Well, Town Square is in the middle of our downtown, and it has tables and chairs, and in the spring it'll have umbrellas and heaters. It has 2 dining stands, and then right across the street, stand-up pods where people can eat in a covered environment. And so that kind of puts you right into the middle of the town, and you can see all your choices for restaurants and the retail that's open, or at one of these public stands, you can get something to eat or drink there. So I think that's a good starting spot for people when they come into town. And then as the weather turns better, we'll continue to have outdoor music every Friday and Saturday night throughout the summer and into the fall.
So when you get the outdoor music, what's it been like to try to book some of these musicians in the middle of a pandemic? Because we're seeing a surge right now in the numbers.
We are. So what we have done in previous years, we've had concerts which have attracted a full stage, full bands, might have 6, 7, 8 members in their band. And they performed and provided a show for people. So they would come and sit down with lawn chairs, shoulder to shoulder, and sit together for 2.5 hours. So we thought we really can't do that. So last year we spread it out. We had the music on both Center and Main Street in different locations, a single musician or a duo, and we tried to place them in a way that people couldn't have easy access to them. And so they would maybe be behind the clock, or this winter, we actually had them in the lobby of our marquee theater with speakers out on the sidewalk. So the music was more of background music for ambiance, and not a performance that people were to sit down and watch, for a couple of hours. And I think that really kept people moving, but they were able to enjoy the music, and it kept everybody safe. So I think we just had to be creative in how we provide that music.
And how is it working as well with the crowds? Because we know people are looking for things to do with their friends, to get outside. And since you're one of the few communities doing this, is it attracting too many people?
That's always a struggle for us. It's a fine line. You want to be able to attract enough people to support the businesses and allow them to flourish, but you don't want to attract too many so that it could be an issue. Through signage and through also discussions with the restaurant owners relaying to their customers, we ask people when they arrive to come masked and to keep their mask on while they're making their way through the district until they're safely seated to eat and eating and dining. So if they're just wandering around with friends, we ask them to stay masked up, and we have signs that will remind them of that. But definitely it is a challenge for us. The one nice thing about having 2 public plazas within our social district area is that people that aren't quite ready to go into an enclosed either outdoor dining space or particularly indoors, they can sit in our town square and drag kind of tables and chairs together so that they can set the distance that makes them feel comfortable. Maybe it's more than 6, maybe it's 10, maybe it's 12. They just want 2 people together. And I think giving them that flexibility gives them a sense of security and safety when they're dining in downtown.
Yeah, that is one thing people should know, is that you need to have your mask on. So even though you are outside, you need to have a mask unless you're sitting down. Has there been any pushback from the public on that?
No. We have people that, we have a minority that are not doing that and have to be reminded. But most everybody wants to do the right thing. They just need to know what it is. You just have to remind them of 6 feet social distancing, washing your hands, wearing a mask to keep everybody safe.
So with that, Lori, just another minute or so here with you on the Megacast. Any other upcoming events that people should know about, and how can they track it?
Yeah, through our Facebook page or Instagram accounts are probably the best way, the most up-to-date that we have. And we are slowly bringing back some of our events from previous years, but because of our street closures remaining in place, we're not going to have any of our parades or our big events in the downtown area, at least for the coming year. We've made some accommodations for Arts and Acts, which has been around for 25 or 30 years, at a new location. We've rerouted some of the parade routes, and we're bringing these type of things back slowly. We'll continue to watch the numbers. We'll continue to listen to the science and decide whether those will actually take place or not. We reserve the right up until the last minute to cancel, just to provide safety for everybody. But we're trying to introduce some of those in a different way, but back to the community.
Well, Lori, we so appreciate your time with us here today.
Oh, it's been my pleasure. Have a good weekend.
You too. Happy weekend. Lori Ward with us. She's the director of Northfield Downtown Development Authority. They have been very creative and trying to continue to offer something to the public and support their businesses as well.
Yeah, they've been doing great things over there in Northfield, very creative, and it's been effective too. We talked with Lori about how some of these other communities across the state are looking to Northfield for advice on what they can do to build these social districts to allow activity in the community while also keeping the community safe.
Well, I know it's worked in attracting people. I went with my girlfriends because it's that walkable community, and you get to enjoy it, and they have those heated pods. So very creative in the city of Northville. Continue to support local, because we are not out of this pandemic just yet. That's going to wrap it up for us. Go Tigers.